Hi guys, this is Dr. Michael Hyman. I'm a urologist practicing in Encino, a suburb of Los Angeles, and you can see some of my other videos on my website, www.drhyman.net, and you can also check out my YouTube channel. Today I just wanted to give you a little insight into something called the PSA density. And why it's a very useful measure of your underlying prostate cancer risk. Remember that as urologists, we're sort of focusing on two separate issues. And make no mistake, they really are evaluated in kind of separate light. In other words, we really think of them differently. One is BPH, or benign prostate hypertrophy, or prostate enlargement. And yes, the bigger your prostate is, the more likely you're going to have difficulty urinating, like getting up at night, slow stream. Although there are plenty of guys who have, an orange-sized prostate, when it should be like a walnut size when we're really young, like in our late teens, early 20s. But it can become the size of an orange. If the channel through that orange, it's like the core of an apple, that's where your urine goes through, is not getting compressed by the inner walls of that channel, you may not have any symptoms. You may not get up at night, you may have a full stream, and so guess what we'll tell you to do? Nothing. There's nothing you need to do if you have a big, huge prostate, but you're urinating fine. Okay? It is not an increased risk of cancer by any means. So it is not true that the larger your prostate is, the greater risk you have of cancer. Now, there's something called the PSA density, and as you will understand what it means, in some respects, the larger your prostate is, the lower your PSA density, all PSAs being equal. In other words, if your PSA is, say, it's used, when we measure PSA, the generalization is that anything under 4 is okay, but we also use something called age-adjusted ranges of normal, and so a PSA could be considered high if you're like 45 years old and it's 3.9 or something. That, it's under 4, but it's a little too high for a guy in his mid-40s. We really like to see it under 3 in his 40s. But again, these are generalizations. And there are some like mitigating factors there. What I want to say is that there is this concept called PSA density, and it means what is my PSA relative to the size of my prostate. Okay, so I'm going to bring out the calculator here, and if I have a PSA, let's say I'm a 60-year-old guy, and my doctor tells me my PSA is 5. And I thought 4 was, the upper limit. In truth, we are more liberal, if you will, about a little bit of an elevated PSA. And when I say liberal, I mean we may not as aggressively pursue a diagnosis of prostate cancer, especially if you have a big prostate. Because a PSA of 5, if the guy's got a 100 cubic centimeter prostate, the PSA density is 0.05, okay? What if he has, that same 50-something-year-old guy has a 25 cubic centimeter prostate, that PSA of 5 divided by the 25 cubic centimeter prostate, his PSA density is 0.2. We think of a PSA density of anything over 0.15, 0.15 is considered elevated. And so that's why that same PSA number could mean a different risk assessment in the same aged guy, depending on the size of his prostate. And sort of, paradoxically for some of you, not for me, but for some of you, because you'll be like, oh, I guess the guy who's got that 100 cubic centimeter prostate, he's really screwed. He's got this gigantic prostate. No. In fact, it's the guy with the smaller prostate that I'm more worried about, because the PSA relative to the size of his prostate, that ratio, that PSA is actually higher in that guy's prostate. Okay, and you just have, and it's kind of like common sense, because the 100 cubic centimeter prostate, this big giant prostate, which let's just assume for a second it's all benign growth. Well, you would expect, I mean, PSA is made in the prostate, even by benign tissue. So you would expect it to go up a little bit, right? In this case, you would expect it to go up a lot. It's a 100 cubic centimeter prostate. I mean, theoretically, you could almost accept the PSA of up to 15 in a 100 cubic centimeter prostate, because that is the cutoff. That would be 0.15 if you follow that PSA density. So, it's right up there, though. It's right up there. And I'm not saying that everybody who has a PSA of, 13 or something with a 100 cubic centimeter prostate can avoid having a further evaluation for prostate cancer. I'm just saying that you need to take all of these things into consideration. And I would basically say, yeah, we should probably pursue this a little bit. If you're like a 60-year-old healthy guy and you got a PSA of 13, but you've got a 100 cubic centimeter prostate, we should pursue it. That means maybe we'll get an MRI of your prostate, and yes, maybe we'll get a biopsy. But my worry, my concern, to me, the level of risk I'm looking at here is far less than if you had a 25 cubic centimeter prostate and your PSA was even less than that. It was like 8, but it's 25 cubic centimeters. What is, those of you who are better math than I am, 8 divided by 25 is 0.32. I mean, that's a really high PSA density. 0.32. I told you 0.15 is the upper limit. So I'm much more worried about the guy with a PSA of 8 and a 25 cubic centimeter prostate than the guy with a PSA of 10 or 15 and a 100 cubic centimeter prostate. Does that make sense? So it's really about the ratio or the relativity of your PSA as a relativity, as a function of the size of your prostate. And again, the bigger the prostate, yes, it's possible, more likely, in fact, that you're going to have some trouble urinating, trouble emptying your bladder, but not a slam dunk. I mean, there are guys who have 30 cubic centimeter prostates and they can barely urinate. They're just dribbling it out because the core of that prostatic channel where the urethra is, where the urine travels, is getting compressed. In that particular case, it grew inward. And then the guy who has the 100 cubic centimeter prostate, he's still wide open, so he doesn't have any symptoms. But yes, in general, the larger the prostate, the more likely. Why do we urologists, everybody who comes in to see me for the first time, if they're like, of age, say over 45 or 50, I generally like to actually do an ultrasound of their prostate so I can get a baseline measurement. And I want to know what we're looking at, regardless of whether he has symptoms. It's just very helpful to see and try to help counsel him, like what your future looks like. But the fact is that if he's got symptoms, if he's getting up 3 or 4 or 5 times a night, if he's telling me his stream is slow, the reason I care most about the size of his prostate is because I'm thinking about what our future looks like should we need to consider some type of procedure. If medication fails to control this prostate enlargement, now we're not even talking about cancer, we're just talking about prostate enlargement. If medication fails to control that, then we have to think about some type of procedure. And that is where size matters. Size is all about knowing what kind of options you have for a procedure. That's really it. I mean, that is really the key. It does also play a factor in some choice regarding medication. So if you have a really big prostate, sometimes that will have an impact on the choice of medication we use, because medication for benign prostate conditions that result in difficulty urinating, those medications basically, by and large, fall into 2 categories. There's one type that actually shrinks it a little bit. It shrinks it maybe 20%, 25%, and it takes a while for that to happen, and it may help urinating better. And then the other category of medication is one that actually takes a little bit of that squeeze or that compression around the urethra where it travels through the prostate, and that allows your flow to improve because there's less grip around the urethra. The hose is being squeezed a little less. And so usually we'll start with the second one, actually. I should have said them in the reverse order. And we'll see if your symptoms get better. And then if they don't, we'll add the shrinking one to the first one to get sort of the dual effect of both of them. They sort of have a synergistic effect. So that's really what it comes down to with size. Not really about cancer per se, and certainly the bigger the prostate, it is not true that that is a greater risk of getting prostate cancer. Just not true at all. Okay, I hope that clarifies some things and people understand a little better. Thank you.